I think the most rewarding thing about being a family physician is being an integral part of the lives of your patients. So when my patients come in, a lot of times, in the beginning, we're just talking about how their winter went or, how things have been going with their family. They share a lot of personal information with me, whether they're going through some hard times financially or maybe with their children at home. And those aspects affect their health too. And so being able to kind of talk to them about what's going on in their lives and seeing how that's affecting all of their possible medical problems, to me that part is the most rewarding, because I feel like that's what matters to a lot of patients. They obviously want to be healthy and they want somebody to tell them what medicine they should be on and what they should be doing, but a lot of doctors can do that, and they want someone also that they can feel like they can connect with. And for me, I feel like that's what family providers do, and that's why we all kind of chose to go into family medicine. Okay. Most people usually go into medicine because they've been exposed by somebody in their family being a doctor, typically. For me, it was a little bit different. My dad was a patient. He had end-stage renal disease, was on dialysis, so my whole life growing up, I kind of watched him navigate the medical field. He had a really great primary care provider who also is an Atlantic General provider, and she sees our whole family, and so I kind of watched him kind of go through appointments with her and kind of navigate everything that he was going through. And I kind of knew from a young age that I wanted to go into medicine so that I could also be a part of other people's families and help them navigate their medical problems and prevent them from getting to a state where it could potentially lead to, morbidity and things like that, mortality. And so that's kind of why I chose to go into medicine. For me, I just enjoyed the aspect of the fact that for family medicine, you're doing a little bit of everything. So you're seeing people from newborn age all the way to geriatrics. You're managing chronic medical problems. You're doing preventative screenings. You do procedures, which I really enjoy doing. Women's health, and I felt like I was able to kind of, instead of just focusing on one particular aspect of medicine and health for a person, I could kind of help them with all aspects of their health. And to me, that was what really interested me in primary care. And so I sort of focused in on that as I went through my schooling. I chose to return to the area to practice medicine because, for one, all of my family is here. I come from a pretty big family and one of 4 children. And so I wanted to be close to them. It was important. Growing up in Sussex County, it was a very small town community. You see the need for providers in this area. And so I knew that I wanted to return here because, they need doctors. I also enjoyed the demographic of this area. You have a lot of farmers who they're really busy and they don't really want to go to the doctor. And I understand that. And so I feel like I can kind of connect to them in that way and try to convince them to come in at least for a checkup and things like that. There's a large geriatric population here, and I really enjoy taking care of those people as well. And then, as we've all seen in the last few years, the area is growing, and so we're getting an influx of families and an influx of children. And so I knew that there would always be a wide variety of patients for me to see here. And so it was always in my mind that I was going to return here after I finished residency. One thing that I would like patients to know about our office here is we really prioritize getting our patients in to be seen. We know that it's really difficult. Sometimes you call doctor's office and they say, sure, you can see your doctor, but it's a couple months down the road and you have a need that needs to be met right then. Here at our office, we really try to get people in to be seen as quickly as possible. We offer flexible scheduling. We have earlier hours. Usually most offices open at 8. We offer times prior to 8 a.m. You know, we often will see people during the lunch hour, things like that, to accommodate needs so that you can feel like your needs are being met.